Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to discuss the post-operative rehabilitation following an ACL reconstruction. Prior to your ACL reconstruction, you can expect to get a femoral nerve block. This is a regional nerve block that helps to numb the nerves going down into the leg. Ideally, a femoral nerve block will make the majority of your leg numb following your procedure. This helps out upon discharge for the first night post-op with pain. Even under ideal femoral nerve blocks, oftentimes the very back portion of the knee is not affected by the block. Because of that, it is not uncommon to still feel pain in the back of the knee following an ACL reconstruction, even if your femoral nerve block is working appropriately. Because it is difficult to predict exactly how long it'll take for the femoral nerve block to wear off, I recommend that patients start taking their post-operative pain medication immediately upon returning to their home. I recommend one pill every 4 hours, regardless of how much pain. That includes waking up overnight and taking a pill every 4 hours during sleep. Once your nerve block wears off and you have some understanding of exactly how much pain you're going to have, then you can decide whether or not you will require the pain medicine every 4 hours or not. I encourage people as early as possible to start weaning from the pain medicine, so that if 4 hours comes along and you are still doing okay, then try to spread out the pain pills to every 5 hours or 6 hours or 8 hours. The less of the pain medication you take post-operatively, the better. However, when your nerve block is still working, you want to take the pain medicine every 4 hours because you don't know exactly how much pain you're going to have. At times, when the nerve block wears off, your pain goes up significantly. This can be expected following an ACL reconstruction. If needed, you can take a maximum dose of 2 pills every 4 hours if the nerve block has worn off and the pain is greater than what is controlled with a simple single pill every 4 hours. Immediately following the procedure, the knee is placed into a hinge knee brace locked in full extension. We also incorporate your Polar Care icing machine down into your postoperative dressing. Please bring the Polar Care and the machine on the day of the operation, as the postoperative recovery nurses will start it immediately following your procedure. You also want to bring your crutches. Even though I am allowing patients to put full weight bearing on the knee following their ACL reconstructions, we want to do so with the hinge knee brace locked in full extension with the assistance of the crutches so that you do not fall. You will then again return to my office 1 month following your procedure. At 1 month post-op, we do an x-ray of the knee to see where the cortical buttons are placed, as well as the position of your femoral and tibial sockets. At 1 month post-op, my goal is that we are starting to see some activation of your quadriceps muscle. In other words, within the first month, it seems as though there is almost a disconnect between your brain and your quadriceps muscle. We need to see the quadriceps starting to wake up and start seeing life in the quadriceps before we can discuss weaning you from the brace. I am hoping and expecting to see some quadriceps activation at 1 month post-op. If that's the case, we will start weaning you from that post-operative hinge knee brace. I do not wean patients from the post-operative hinge knee brace all at once, however. Usually this is a slow process that can take up to a week or 2. The reason is because the knee brace is really substituting for the function of your inactive quadriceps muscle. Initially, when you remove the knee brace, it may seem okay, but as the muscle becomes fatigued with time, you start to feel as though the knee may buckle or give way on you and you do not trust the leg. It is during these times of muscle fatigue that I encourage patients to go back into their postoperative brace. With the postoperative brace reapplied and placed into extension, you are safe. It is during times of muscle fatigue without the brace that you are at the highest risk of re-injury during the early periods of rehab following an ACL reconstruction. I encourage patients to listen to their body and be honest with themselves about when the muscle is fatigued and when it is time to go back to the brace. Over time, as you transition away from the brace, I expect the amount of time that you can walk or stand without the brace to slowly increase. Eventually, you will find that you can get through a whole day without the hinge postoperative knee brace, at which time it can be discontinued. During the second month of rehab, the focus of an ACL rehab program changes from simple swelling and pain and stiffness to more strengthening exercises. It's during this time that you will begin more exercises such as a stationary bike, walking backwards on a treadmill, as well as a mini tramp. You are seen back in my office for repeat evaluation at 2 months post-op. This is where I'm really evaluating for how your muscle is initially coming along. I do not expect at that time that your muscle will be fully recovered. I am hoping to see better strength and control in the muscle with your successful transition away from the hinged postoperative knee brace. In the months to follow, we add progressively more difficult rehabilitation exercises. Initially, all those exercises are performed in a straight line fashion with no cutting, pivoting, or jumping. As time goes by, we may add more sport-specific rehab exercises to your protocol. In order to do so, you must demonstrate to me and to the physical therapist that the strength and the control of the leg and knee is improving. In order to return to sport following ACL reconstruction, you must be able to demonstrate that you can control the knee in space and protect it from future injury. This is the portion of the ACL rehabilitation that can vary significantly from one patient to the next. And although in general I tell patients, and specifically athletes, that on average it may take 6 months to recover fully from an ACL reconstruction, the reality is that we do not clear patients to return to sport until their full function and control of the leg has been restored. For some patients, this may take longer than 6 months postoperatively. We do see patients at 6 months postoperatively where we repeat x-rays of the knee and repeat the functional evaluation. It is only through careful consideration and determination of progress through physical therapy do we allow patients to return to sport. I always remind my competitive athletes after completion of their ACL rehabilitation program that although I am clearing them to return to sport, it may take some time before they are able to return to that sport at a level of competition that they were at preoperatively. Oftentimes, patients report that they do not feel as though that they are participating at 100% until nearly a year after an ACL reconstruction. At approximately 5 months postoperatively, we will fit you for an ACL functional brace. This brace is much different than the postoperative hinge knee brace that you had immediately following the procedure. An ACL functional brace is designed to provide additional stability to the knee during your transition back to sports-related activities. This allows for greater control of the knee, but also adds a significant psychological component to the confidence that patients feel as they try to return to their sport or to their activity. Even though I may have cleared patients to return to work or to return to sports following an ACL reconstruction, I usually have them follow up in the office at 1 year post-op, both to repeat an x-ray to see if there's been any chronic changes within their tunnels, as well as to see how their transition back into their activities has gone. You can expect to continue to see growth of your body into that new ACL ligament for up to 18 months postoperatively. This process is called religamentization. Because the religamentization process takes 18 months, I recommend that patients use the ACL functional brace upon returning to sport for 1.5 years following their surgical date, or 1 year following the completion of the rehab process. I hope this video has helped you to better understand the complex nature of the postoperative rehabilitation following an ACL reconstruction. Although the road to recovery can be long and arduous, rest assured that you have the full support of the Quincy Medical Group Department of Orthopedics as well as your physical therapist. Together, we will ensure that your journey is a successful one. Thank you again, and take care.